Hey, you all, it's time to wake up. Today, we're going to be talking COVID-19. It's really time to wake up. I need you, though, to hit that like button and hit that subscribe button, and we'll get it on. We'll get it on. All right, when we come back, it's Dr. Redcross talking about COVID-19.
Absolutely. Thank you for having me on, Steve. I'm excited to be here with everyone. I miss going to Detroit in person, but that's all right. We're going to do it this way.
Well, Dr. Redcross, much has been made of the racial disparity in the way COVID-19 has hit America.
Yeah.
What is the difference between the black rate and the white rate here?
All right. So look, we are almost 2 times the rate of what we're seeing in Caucasian Americans. And look, that's multifold, Steve, as we talk about that. Number one, let's look at the disease states that we see that are affecting COVID. Tends to be heart disease, lung disease, obesity, and diabetes, all 4 which can really run rampant in the African American community. And then you pair that up with the fact that we're also starting to see that vitamin D deficiency can be playing a little bit of a part in that as well, because vitamin D, while it's not a treatment for the coronavirus, Steve, it's important for our immune system. And African Americans, about 80% of us are also low in vitamin D. So it's kind of multifactorial of why we're having these challenges in our community as well, besides some other social factors that come into play, such as social distancing in a lot of our communities, Detroit, Chicago, here in New York City where I am. It's hard to socially distance. It's a luxury to be able to do that. So that's a problem.
Well, we have Thanksgiving coming up. How are
Yes.
we really supposed to socially distance next week at Thanksgiving?
Look, let me tell you this, guys. So look, Thanksgiving is my favorite holiday. Family comes together, there's love, there's good food and that sort of thing. But this is a time to keep it small, to your own little network in that house, your kids, your parents, and that sort of thing. It's kind of hard to have that extended family come from outside and potentially bring something in, or even still, you get that spread of air back and forth. And that's what we're trying to cut down. So this particular Thanksgiving needs to be like none other, Steve. It needs to be very, very close knit and still full of a lot of love. Thank God for Zoom and Skype and all these other things that we still can kind of have a little bit of fun with the holiday.
Dr. Redcross, before we go any further, why don't you tell our viewers about your background?
Sure. So look, I am a Western trained physician. I train here in Columbia in New York. And one of the things that's always been important to me, Steve, is that
Columbia Medical School?
Yeah, Columbia residency in the city, here in Washington Heights. And so one of the things that's always been important to me, while I'm a Western trained physician and I bleed Columbia blue, the point is that I talk about alternative ways of healing as well. I'm also a concierge physician, so I'm not the typical doctor that's in the office. I make house calls. That's my business. I make house calls. I make sure to talk to people all around the United States and give advice and counsel. That's my practice. It allows me to get into the soul of the patient, if you will. And so that's the important thing to me. I know that this is my calling. And so I'm very fortunate and blessed to be able to practice this way.
So you've written a book.
Sure.
Let's talk about that book real brief. Then I want to get back into the other part of this discussion.
Sure. So look, everyone, that book is called Bond. And bond is important to me because my passion is that patient-doctor bond or relationship, which is built on 4 cornerstones: trust, respect, empathy, and communication. And all 4 of those are necessary to have the perfect relationship with your doctor. And that's something that we tend to lack, especially in a lot of the underserved areas with brown and black folks. And those are the 4 things we should be demanding from our doctor each and every day. And that's the importance that I talk about in this book, about making sure you get that bond with your doctor, because look, it improves healthcare outcomes. We know that.
All right, doctor. We have just closed down the schools, the high schools in Detroit.
Yeah.
Talk to me about the disparity of African-American children contracting COVID versus Caucasian children.
Yeah, those numbers are horrible to see, because once again, it's that social distancing challenge that we get, because most of the brown and black communities are not able to telework. So what happens, Steve, is they have to go to work and they come back home. And then they're in Detroit and even in New York, we're closing our schools down again as well. So it's that horrible cycle that we see coming back and forth. And it's important because when I talk to the parents about how we can make sure that we keep our immune system at least stable, that's when the vitamin D story comes in. It's very important for everyone, but especially for our communities as well, whether it be African Americans or the Latino community also.
Well, let's talk about vitamin D. I had another doctor from a Middle Eastern community tell me that he bet my vitamin D was low.
Yeah.
All right. And it
Yeah.
needed to be boosted up. What is the correlation between vitamin D and COVID-19 survival?
Well, Steve, I'm glad you didn't bet him because the chances are he was probably right. Because in our community, as I stated before, it's up to 80 to 85% of us are low. But what are we going to do about that, right? The whole purpose of my campaign is to challenge everyone out there watching and listening to just know your vitamin D levels. I want you to make sure that the levels are between 40 and 60. And when you get your levels checked, it's hard to get to the doctor's office now because of COVID, but you can go to websites such as thepowerofd.org. And at thepowerofd.org, Steve, you can order an at-home test kit. So you can order the kit, get it sent home. It's a finger stick. You send the results back, and they even have a calculator on that website. So at thepowerofd.org, it's not only about ordering the test, but you get the results, you put them in, and the calculator lets you know how much vitamin D you should be taking as well. So it's very comprehensive, especially if you can't get to your doctor's office. But it's about that immune system. It's about that now what? Because we socially distance, we wear masks, and we make sure we're washing our hands. But what else can we do? Well, that other thing is to make sure that we're all getting our vitamin D levels. As I like to say, get on my level. And my level is between 40 and 60, where I want everyone to be.
Let's say our vitamin D level is lower than that. How do we increase it?
Well, the best thing, and the thing is, like I said, I'm back to that natural thing. For me, it's about staying closer to the earth. But the challenge, in order to do that with our diet, everyone, our diet's not rich in vitamin D. It's not rich. When you think about milk and cream, that stuff has added vitamin D. That's not the point. So it's hard to get it. So it's something that you have to supplement. Thank God, vitamin D is pretty affordable. And so it's easy to get, but you usually have to supplement. When I talk a lot with my patients, it's usually between 2,000 and 5,000 international units to really get your levels up to that 40 and 60.
Doctor, that's a whole lot of vitamin D.
Oh,
A lot of vitamin D.
Oh, no, when you think about it. So look, when you go and you look over the counter, usually you'll see the 1,000 international units of vitamin D, but it's usually not enough to get your levels up into that sweet spot. But that's the other purpose about making sure that you get your levels checked, whether it's at thepowerofd.org, whether it's with your doctor, know what those levels are. And I'll tell you, everyone, I take 10,000 units of vitamin D a day, and my levels are still only around 60 to 61, because don't forget that brown skin of ours keeps the sun's rays out. So we're not able to convert to have our own natural vitamin D. In addition, we're all squirreled away in the house, in the home, also not getting vitamin D. So keep that in mind as well. So it's really not that much as far as the dosage when you think about the 2,000 to 5,000. But once again, let's get our levels checked.
But what if you're high yellow like me?
High yellow or not, you're still not, you still don't have that Caucasian skin. So you're still not going to necessarily convert it the exact same way. I have a lot of high yellow people in my family, and I tell them the same thing. You got to still make sure you're getting in there and knowing what your levels are. Very, very important to do that. It's about that new state of education. What else can we do as we get to the coronavirus to help to kind of support our immune system? Not directly treat it with vitamin D, but support our immune system. Look, we have good studies already out there, Steve, as far as what vitamin D can do to help support our immunity, our lung function, insulin resistance, and also even a role in helping manage obesity as well. So when you look at that and the vitamin D story, this is something that we all need to make sure we get on, and get on it fast.
Okay. Dr. Redcross, tell people how they can get in touch with you.
Oh, sure. So feel free to reach out. So Ken Redcross, MD, whether you're an Instagrammer, Twitter, Facebook, LinkedIn. I always love when people reach out with questions. And to what I do, I provide advice. I provide strategic advice to keep everyone healthy and whole. So I just want to make sure that everyone out there is just staying healthy, staying very blessed, and staying educated as we talk about vitamin D and its role.
Okay, Dr. Redcross, I want to thank you for joining us today. You opened my eyes to vitamin D, and I'm really worried about Thanksgiving because it's one of my favorite holidays too.
Yeah, it's going to be a challenge, but all it needs is love. All we need, and we can have a good one.
Okay. Ladies and gentlemen, you just heard Dr. Ken Redcross. Pay attention to your vitamin D levels and make sure you wake up, hit that like button, hit that subscribe button. Have a great day. Great day, ladies and gentlemen. Great day.